Ever wonder what motivates people to get plastic surgery?
Did they regret it?
What can we learn from the weird and wild stuff that happens at our plastic surgery clinic? We're going to tell some stories, get some laughs, and learn on
Clinic Talk with Sabrina Sajan
on the Plastic Surgeon Podcast.
Hello, my friends. I'm Dr. Javad Sajan. I'm here with my lovely wife and CEO of Allure Esthetic, Sabrina Sajan.
Welcome back and thanks for listening. Please rate and review us on Apple Podcasts to support the channel. On Clinic Talk, we tell real stories of fun, strange, hopeful, and educational things that happen at our clinics from day to day.
We get a lot of weird and hilarious happenings at the clinic.
You can find the clinic at allureesthetic.com for more information. So, Janu, what clinic stories are we going to talk about today?
We had so many people who are expecting. I heard you threw a baby shower.
Yes. We had a baby shower last week. It wasn't for me.
How many people?
It was 3. So 3 of our staff members.
Why do we always have things happen in 3?
Yeah, I don't know. It's really weird. We hire in sets of 3s. People get pregnant in sets of 3s.
People quit in sets of 3s.
Yeah. I don't know what's up with the 3s, 3 musketeers all the time.
Mm-hmm.
But yeah, we had a baby shower last week for 3 of our staff members. And they're all expecting back to back.
Who is it?
We have Natalia, our PA. Then we have Kyla. I think many of, a lot of the surgery patients have probably met her because she does a lot of the ultrasound massages. She's a master esthetician and medical assistant. And then we have Gina, one of our nurses. And yeah, all 3 of them are expecting. 2 of them are having boys.
Oh, cool.
And 1 of them are having girl. And yeah, they're super excited and, really enjoy the baby shower. And it was a lot of fun.
And I saw that on the IG that there were some like cake-like things somebody made.
Oh, yes. Yeah. Belinda is really creative. And she, anytime we have, someone expecting in the office, she'll make them diaper cakes.
What? What's a diaper cake?
So basically what it is, it's a cake, but it's made out of baby onesies and diapers. And basically you can use it as a decor in the baby's room. And then eventually you end up using it. Usually has like a good 30, 40 diapers in there. And it's like a 3-layered cake that's made out of diapers.
Oh, that's cool.
Yeah, it was really cute.
Did people like it?
Yeah, everyone really enjoyed and it was a lot of fun.
So how did you keep it COVID friendly?
Yeah, so we had 10 people on the dot. And that's the restrictions right now here. So you can have 10 people indoor together. So yeah, we had 10 people.
That's cool.
And we also kept it a drive-through baby shower. So people could just stop by and then kind of wish them good luck and then kind of head out. So we had it for a few hours where people could just stop by.
Oh, so they drove by, throw the gift and kept driving?
No. It's like a stop by baby shower, right? So it's like basically like an open house.
Oh, okay.
So it's like open for a few hours and you can come anytime you want. There's no specific time for you to arrive. So it's like an open house. That's cool.
Yeah, I really hope once COVID hopefully slows down more, we can get back to doing all the events. I think it really builds culture and helps people connect.
Yeah, definitely.
You see such a higher level of disconnect in this COVID world. You notice that?
I do.
I see people a lot more to themselves and much more private and quiet than what I just remember a year and a half ago.
Yeah, I felt like the office was such a more friendly environment and people really connected with each other. We used to do these monthly team meetings. A lot of the staff and the doctors really missed that. And, it's unfortunate, but yeah, this time we can't have them, but they were, full company team meeting once a month. We used to all have breakfast together and have an inspirational talk from one of the surgeons and introduce all the new staff. And it was really a way for everyone to connect with each other. And it's really sad not to be able to do such things because it really helps the team morale and the different values and to instill that into all of the staff.
Yeah. And we certainly do a lot of things virtually now, but human beings, I think, are social creatures. And no matter how much you do with Zoom and electronically, that human connection is so important. I think it gets to people's inner soul and helps drive them and motivate them.
I know. And I was just looking at to see if we should do something maybe 4th of July or something like that. But I think I heard that they're going to re-shut things down and move things back to phase 2 or something.
Yeah, I hope that doesn't happen.
I know. I was hoping to go to phase 4 so we can do such events.
Well, everybody, please get your vaccine.
Yes. Get your vaccine and stay safe.
John, I have one thing. TouchUps, TouchUps, and TouchUps.
I think some of our injector providers would say that too.
So we love doing injections. We love it. Botox, fillers. We do a lot of it. So we have a policy at the office, right? Mm-hmm. Well, if somebody gets an injection and they're not happy or it doesn't work out well and they need a touch-up, we will do it for free.
Yeah, or we'll do whatever it takes to make it right.
Exactly. But guys, that doesn't mean if you want more, it's called a touch-up, right? Yeah. So when you get a filler of syringe, let's say put in your lips, right? You're getting 1 cc, you get that, it's done, but you can't come back and say, I want to touch up because my lips aren't big enough.
Yeah, we get that a lot of times.
That's called a redo, and you got to pay for more filler.
That's called your lips need 3 syringes.
Exactly. You're not going to go from, I don't know who has really thin lips.
I don't know.
I guess you're not going to go from Kris Jenner lips to Kylie Jenner lips with 1 syringe. Is that a good analogy?
That's a fact.
Okay. So it takes multiple. So what is a touch-up? I'm going to go through this. A touch-up is considered a treatment to correct a asymmetry or misinjection that happened. So for example, let's say one eyebrow went a little higher than the other. Touch it up. Let's say you got a little lump in your lip. We'll touch that up. Let's say your filler looks crooked and one cheeks look really high. We'll touch it up. But wait, hold the boat here, okay? Now, when we put filler on the cheeks, I put the filler on the bone, guys, on the bone. Nobody's cheeks are symmetric. Look at me. My right eye is bigger than my left eye. I don't like it. I want to push it in. I push it in every day. It doesn't go in. However, the filler goes on the bone. And if your bone is crooked, everyone's face is a little crooked. Your filler is going to be a little crooked. And you have to learn to be happy with that.
Yes, exactly.
Exactly. I'm not passionate about this. Doesn't bother me. But a touch-up is a correction because something may have not been done properly or didn't heal well. The one thing with these little procedures, right? You've seen this. You can do the same thing 1,000,000 times the exact same way on 1,000,000 identical twins, and everybody heals differently.
Yep.
People are people, right? It's like going to a restaurant. You get the same dish. Some days it's great. Some days it might not be as great. It's a variety.
Yeah. Or sometimes we'll get a call from patients, they got their Botox treatment or Dysport treatment. I think you have one coming up on Monday. Uh-huh. And the
sorry.
And the patient came in to get her normal, 30 units of Botox, got her treatment. And she calls 3 months later and says, oh, the doctor said that it was going to last 6 months to 9 months. No. We never said that.
Never. Guys, it lasts 3 months if you're okay, on average. It could be less, could be more. No one said 6 months. I didn't say 6 months, come on.
They said you said.
Yeah. I love my patients. They're amazing. They're sweet. I'm so thankful. I'm grateful to God to have my patients. But sometimes, people hear.
That's called trying to sneak in a touch-up. Exactly.
Mm-hmm. Or the touch-ups that get me are the people, some who legitimately want to get more filler, but they call it a touch-up just to get fast track on the schedule.
Yes, exactly. We know those tricks and turns, guys.
I know. And we don't mind. Obviously, we'll take care of you, but you're going to get on the DNS list.
Yeah. Now we have a new asterisk list.
I know. What's the DNS list?
Do not schedule.
Don't be on the list, Now
we have 3 levels. We have the regular patients, we have an asterisk, and then after that, you go to the DNS.
The asterisk list does not get touch-ups, right?
No.
Oh, goodness. Look, we love all of you. You guys are amazing. 99% are amazing, super people. We couldn't do this without you. We know we are who we are because of our patients, on a serious note, and we're so thankful for them. Sometimes, like all of us, right? Some people get a little bit more, require a little bit more TLC than others. And we're going to give TLC. I love TLC. We give lots of TLC, but there's a fine line between TLC and taking advantage.
Yes.
Can't walk that line, right? Or you get on the DNS list, please. And people get mad.
Be aware.
Or then you get blocked on IG and then you call the office and you get back on IG.
Oh, yeah.
Oh, goodness.
You got to tell the story about that.
Okay. So I'm walking around the office saying hi to all my staff, right? We got a bigger team now. I'm like, hey, how's it going? I try to say good morning to everybody because I really care about my people, want to know how they're doing. So I am running around the office and I hear, and the new person, Isabella, comes to me running. She's a new staff. She's one of our PCCs. She's amazing, but she always looks nervous and scared. She's trying to work on that.
Because she's new. It's like her second week.
I know, but I know. She always looks scared. I'm like, what happened? Did somebody scare her? Did I scare her? But yeah, she's just new. It's just the jitters.
Yes.
The jitters. So
it's her first real job.
It is. She's an amazing person. So she comes running to me. I'm walking by. She doesn't run to me actually, and she's talking to Belinda. And she's like, oh, this person saying they're blocked on Instagram, but they have a consult coming up.
So can we unblock them?
Yes. Now, we didn't block people, but the only people that get blocked are haters.
Yeah, we have a social media team. And, if you say inappropriate things and you are not nice about the pictures that are posted online, I mean, you have to understand those are patient pictures. Mm-hmm. Those patients are watching the comments that are coming through. And if you're not nice, you're going to go on the DNS list.
Exactly. And, if you have a question, you can always send a DM. If you don't like the way something's done and you want your surgery or procedure done differently, you can talk to us, send a DM. But like posting a lot of negativity on people's body images isn't a nice thing. I know when you put before and afters, you put yourself out there. I'm happy to do that. I don't mind. I take the criticism. But you can't like insult people and make fun of them and be mean or like swear. So if you do stuff like that, then you get blocked. Sorry about that, but it's just what it is. We gotta moderate the group,
Mm-hmm. I agree.
And what happens is if we don't take that stuff down, then one of the real reasons we really have to pay attention to it is if, IG moderates everything. And if you have a lot of hateful talk and we don't delete it, our account can get banned. So I don't mind the criticism, but we have to protect the patients, right? Number one. And number two, we don't want our IG to get blocked because all of you know I'm the only verified plastic surgeon in this entire state.
Yeah. And the patients really enjoy looking at Instagram, watching the stories and all. I want to give the opportunity to those patients that want to watch.
Mm-hmm. Exactly. So John, I heard that someone's ex-husband called to cancel a surgery.
Yes. So how it actually started was a couple came to a consult. It was a full mommy makeover consultation. And they scheduled surgery on the same day and they paid their deposit and they picked their date and everything. The patient then had their pre-op and everything. It was like maybe 4 or 5 weeks the surgery was going to happen. And we get a call from the husband and, we have a special form and special process if a different person's paying for your procedure and a different person is allowed to have access to your information. So he was on all of her stuff and she gave him access to be able to pay for her procedure. And he had access to all of our patient stuff. And she, signed off on it and agreed to it so we could discuss things with him, which we confirmed with her. And all of a sudden, like a few weeks before surgery, we get a call from her husband. And he was like, oh, I just need to cancel so-and-so's surgery. And we're like, okay, her surgery is in a few weeks and everything's already paid for. Everything's already done. He was like, yeah, she doesn't need it. And we're like, okay, is there something we can help you with? Like, what's going on? Like, we haven't heard from her or anything. And she was like, yeah, you don't need to hear from her. I'm telling you, I paid for it. So she doesn't need the surgery anymore. And just the way he was being aggressive and being very rude, it seemed a little fishy.
Yeah.
So, we talked to him and we hung up the phone and then we called her and we're like, hey, just wanted to check in. Your surgery's on this date and everything's scheduled. And she's like, yeah, everything's scheduled and I'm ready to have surgery. And she's like, why? Why are you calling me to ask me this? And we're like, oh, we just wanted to know if everything's okay. And she was like, are you talking about blank? And then she said his name and we're like, yeah, how did you know? And she was like, yeah, he's trying to call everywhere. I had appointments and things scheduled and he's canceling all my cards and he's trying, I'm guessing he tried to cancel my surgery too.
But they were married when they came in.
Correct. So they were married when they came in, but she went into detail and she was like crying and stuff. And she was like, she told us that they're basically separated and they're going through a really bad divorce.
Oh.
And
this is my patient.
Yeah. And even though the surgery was fully paid, he's still trying to cancel surgery, even though he may or may not get the money back. But he just does not want to let her have the surgery.
Oh, yeah, because it's non-refundable within 3 weeks.
Yeah. And he even said it himself. He's like, I don't want the money. I just don't want her to have the surgery anymore.
That's rough.
Yeah. And she was like crying and stuff. And we're like, well, it's already paid for. You can show up on the day of surgery. You'll have the surgery. I mean, everything's already a done deal at this point.
Yeah.
And you're the patient. I mean, you have, it's your right and you have access to, have the surgery and everything. So then she sent us a letter and an email saying that she's requesting to not discuss anything else ever with him and take him off her chart and take him off of the emergency contact and everything. But it was like a back and forth because he kept calling the office because he wanted to make sure that she wasn't going to have surgery.
That's out there, and that whole thing. I had a very different situation. So this one's wild. So I had a patient who comes in with her husband. They have 4 kids. They came from Eastern Washington. Yeah, really nice, normal people, as far as I know. And when we're in the room, the husband's always very flirty with the staff. And she it doesn't say anything like it's normal. He's always commenting on on the assistant. Oh, you look good. Or I remember one time he said, "Oh, is she going to look like her?"
Oh my God.
I just wanted to fall on the ground and disappear. You heard that feeling?
Hide under the desk.
Yes. And his wife was like, whatever. She didn't even care. Just did that type of thing. I'm like, okay, so that's fine. So she gets a big mommy makeover. We're doing everything. We're doing breast augmentation. We're doing tummy tuck and a BBL, all 3 together. And she signs up for surgery and everything's great. It happens. Surgery goes great. She feels amazing. She's really happy with the result. And then she comes to her first post-op. Yeah. And and she's there with her sister. Yeah. So I'm like, okay, cool. Then I ask her, "Oh, how's your husband?" She's like, "Oh, I left him." I'm like, what do you mean I left him? And she's like, "Oh, that."
In that accent?
Yeah. She was like, "That cheating mutt, bleep, 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 bleep. I had him pay for all my stuff and I let him go right away after." So then
he didn't even get to see her.
No. Then she said, yeah, he was a big cheater. Cheated
so
on her.
She knew that before.
Yeah. Cheating on her for years. She didn't want to say anything. She right away, but she confronted him about it before the whole surgery. And his way of making up for the cheating was to pay for the surgery. Oh. And then he thought everything was going to be all good after the surgery, but she got the surgery and she left him.
And she pieced out.
Yep. And she kept, then they were fighting for the kids and all that kind of stuff.
Oh man.
But that was something.
She got the surgery at least.
She got it done. Yeah. She was really happy with it. Very nice person. But that's the opposite, huh?
Yeah,
almost.
It is.
Yeah.
That's funny.
Thank you for listening to Clinic Talk on the Plastic Surgeon Podcast. Please rate and review us on Apple Podcasts and support the channel.
Tune in next time for more Clinic Talk. We have more great stories coming your way.
For my live surgeries on Snapchat and adventures throughout the week, catch us on all social media at realdrseattle.
See you next time. Bye.
Bam. What?